Thanks to the dedication from our 33.5 million volunteers and supporters, and together with our strategic partners, 2016-17 has been another year of breakthrough progress for the American Heart Association. Please join us as we celebrate the highlights and achievements that made this an unforgettable year. In a truly historic moment, the AHA, Verily, an Alphabet company, and AstraZeneca announced Dr. Callum McRae of Harvard University as the leader of One Brave Idea, a novel research enterprise to transform how research is done and to work towards a cure to end coronary heart disease and its consequences.
We just have to do better. With the unique opportunity of One Brave Idea, we have the chance to move in a potentially game-changing way much earlier in the disease. In fact, in our One Brave Idea proposal, we focused on finding new and creative ways to define the very earliest stages of disease, the transition from wellness itself.
AHA and the Patient-Centered Outcomes Research Institute turned to crowdsourcing to find out what patients, clinicians, and researchers considered the most urgent priorities in cardiovascular medicine to shape the direction and design of research. In San Francisco, experts from around the world convened at our Health Tech Forum to develop healthcare solutions through our newly created Center for Health Technology and Innovation. At Scientific Sessions 2016, we announced My Research Legacy, a collaboration with the Broad Institute of MIT and Harvard. My Research Legacy champions, heart disease and stroke patients, are leading the way by donating their own health data to advance scientific knowledge.
I think it's important for all of us to tell our stories. I think it's important for the stories to be collected in some fashion and shared.
I think that any time that we have an opportunity to participate in research, that it's our responsibility to.
Also at Scientific Sessions, we announced our ongoing strategic partnership with Amazon Web Services to power the AHA Precision Medicine platform. This cloud-based platform will revolutionize the way researchers can access and analyze rich and diverse data to develop precise approaches to reverse, prevent, and cure cardiovascular disease and stroke. The AHA and the Paul G. Allen Frontiers Group each committed $1.5 million to support extracellular matrix research, which will advance our understanding of the tissues and fibers of the heart. We launched strategically focused research networks for obesity and children's health, and our board of directors approved new networks for atrial fibrillation and vascular disease. Thanks to the generous support of the Buehrer Foundation, we presented the first ever Thinking Outside the Box Award for stroke research, honoring the memory of Dan Adams, a longtime Buehrer Foundation trustee whose memory lives on through his unbounded passion for science and research and devotion to helping people who face cardiovascular diseases and stroke. We're also proud to announce that the Buehrer Foundation has committed an additional $11 million to create the American Stroke Association Buehrer Centers of Excellence in Hemorrhagic Stroke. The centers will prioritize multidisciplinary approaches to energize the field of hemorrhagic stroke research while training a future generation of stroke science leaders. In total, the Buehrer Foundation has donated more than $45 million on behalf of the American Heart Association and American Stroke Association. Fundraising is essential to the success of our mission, and would like to give special thanks to everyone who gave generously on our behalf in 2016-17, including individual donors, foundations and trusts, corporate sponsors, and the millions of people across the country. By joining the World Economic Forum, the American Heart Association joins business, political, academic, and other leaders to improve the state of the world.
Here at the annual meeting of the World Economic Forum in Davos, Switzerland, and I'm joined by Nancy Brown, who is the Chief Executive Officer of the American Heart Association. Nancy, welcome.
Welcome to you. Thank you so much for having me. You know, the American Heart Association is very focused on equality in healthcare and social justice. It's something we care deeply about. It's part of our core values and foundational to the work that we do.
the AHA published its first scientific statement on the health risk of added sugars for children and recommended specific limits for daily sugar intake.
Under the AHA guidelines, children should have no more than 25 grams of added sugars each day. That's roughly 6 teaspoons, amounting to 100 calories. And before they hit the age of 2, babies and toddlers should not consume any foods or drinks with added sugars.
We also published our first statement highlighting the importance of adequate sleep to prevent obesity, high blood pressure, diabetes, and other cardiovascular risk factors. In September, the AHA joined with the White House to host a briefing on progress in the treatment, prevention, and diagnosis of cardiovascular disease. With the generous support of Subway, we launched the Plus Color campaign to encourage people to eat more fruits and vegetables as part of an overall heart-healthy lifestyle.
And when you add a serving of color to your plate, you may get a healthier, longer life in return. Life is why. Color is how. Add color.
Together with actress Elizabeth Banks and digital media company Hoo Ha Ha, we created a series of videos combining comedy with advice on nutrition, exercise, and risk factor control.
Reporting live, I'm Christine Lancaster for Action News. Ladies, how did you become local gym heroes? One word, accountability. We drag each other to the gym. Literally! Go, 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 go. Yeah! Woo, faster than ever! Yeah. Ooh, let's go, let's go.
During February, American Heart Month, we once again presented the Go Red for Women Red Dress Collection fashion show, thanks to the generous support of Macy's. Supporters across the country wore red, and at the Women's Day Red Dress Awards, we honored leading advocates for women's heart health, including Layla Ali. Hosted by Ariana Huffington of Thrive Global, national media executives, reporters, and journalists discussed strategies to advance women's heart health awareness.
I mentioned it earlier, today's all about girl power, and I gotta mention our health. I attended an event this week hosted by Ariana Huffington and the American Heart Association. The goal, to raise awareness of how heart disease affects women. Did you know it is the #1 killer of women in the United States, but 80% of those deaths are preventable?
The CEO Roundtable, comprised of 29 members, released the results of a national Nielsen survey providing key insights to implement meaningful workplace programs that can have measurable impact on employee health and engagement. We introduced our Workplace Health Achievement Index, providing employers evidence-based standards to evaluate the quality and effectiveness of workplace health programs. As of March 31st, approximately 1,000 companies have participated, showing 50% growth from the inaugural cycle, with CEO Roundtable companies leading the way. Along with the Robert Wood Johnson Foundation, we completed year 4 of Voices for Healthy Kids, helping kids make healthier choices in the places where they live, learn, and play.
Not all kids get the same healthy choices, and that's a pretty big problem. But there's a call for change being heard across the country, which means kids like me get the best start in life, where we live, where we learn, and where we play.
And we celebrated the 11th anniversary of the Alliance for Healthier Generations work to reverse childhood obesity by creating healthier environments in more than 31,000 schools. Together with the YMCA, we aim to improve blood pressure control in underserved communities. With 2,700 locations and a presence in 10,000 communities, we're partnering to take health care out of the clinic and directly to the people who need it most. Our Empowered to Serve movement launched the Take Me Home campaign to spread awareness about the causes of health disparities in diverse communities. 3 years ahead of schedule, we achieved the milestone goal of training more than 20 million people worldwide annually in CPR. More than 300 AHA research awardees, thought leaders, and AHA leadership came together to promote the exchange of scientific and career ideas with experienced investigators and newcomers to the field. Along with the Resuscitation Academy Foundation, we co-founded the Global Resuscitation Alliance and set a bold goal of increasing cardiac arrest survival rates by 50%. In October, At the Great Wall Conference in Beijing, we announced a new agreement to provide CPR training in China. Together with the Children's Heart Foundation, we proudly announced the second round of recipients of our Congenital Heart Defect Research Awards. In April, the United Arab Emirates became the first country outside the United States to implement our Get With the Guidelines Quality of Care program. Together with the American College of Cardiology, we offer a single solution to accredit hospitals qualified to treat the most complex cases of heart disease. This spring, we celebrated a milestone advocacy victory when the Centers for Medicare and Medicaid Services approved therapy coverage for patients with peripheral artery disease. And in communities across the nation, advocacy achieved major progress in priority areas, including sweetened beverage taxes, CPR in schools, safe areas for walking and biking, and more. To all our 33.5 million volunteers and supporters, together with our strategic partners, thanks once again for making 2016-17 an unforgettable year. You're helping to make our mission of building healthier lives, free of cardiovascular diseases and stroke, a reality.